Indians. Welcome to India Meet Session and the world's largest AIDS conference or 26th International AIDS Conference in the beautiful city of Rio de Janeiro, Brazil. This India Meet Session is co-organized by Gujarat AIDS Awareness and Prevention, GAP, ICRCT, AIDS Society of India or ASI, and People's Health Organization. And it is on the theme of Local to Global, India's leadership in global AIDS response. It is my great honor to invite Dr. Ishwar Gilada, Governing Council Member of International AIDS Society or IAS and Chairperson of IAS Asia Pacific. Please chair this session. Dr. Gilada has himself embodied Lead India spirit in his over 4 decades of contribution to the AIDS response in India as well as globally. Be it establishing India's first HIV clinic in JJ Hospital or diagnosing the first few HIV cases in India or establishing India's first comprehensive HIV care center, he has led from the front. Welcome, Dr. Gilada. Over to you.
Thank you very much. We are at this International AIDS Conference in Rio. My very simple logic that how India has come up in 40 years and how this logic of local to global, which can be short form as local, has come up here. When we started reporting first cases in 1986, until 1990, we thought that India will top the AIDS this decade. And by 1995, we are already number 1. Today, India is number 1 in population, number 2 or number 3 in HIV cases. But beyond that, in response, 92% of the world's HIV positive people are taking medicines made in India. If the global HIV scenario is taken into care, minus India, you can imagine where are we. Unfortunately, the global community, including the WHO, UNAIDS, all those big people who spoke at the opening ceremony here, they speak everything, but they do not utter a word of India. Today, millions of people are alive only and only because of India. It's not only HIV medicine, it is also vaccines, which are lifesaver vaccines. There are also medicines which are for antibiotic and other lifesaver things. And if we take the cost, whatever is available in $100 globally, India makes it available for $1, even less than $1. If we talk about Lenacapavir, which is $44,000 for 2 injection globally, it has come down to $30,000 by the innovator company. India is going to make it available for $40. That is 0.4% of international cost, 0.1% of international cost. So in this scenario, if we look at the responses, if we look at the medicine, if we look at the vaccines, if we look at the technical management skills of managing patients at low cost, India has shown the world the way. And today, there are few companies from India which are meeting the global requirement. The quantum it is required, in the amount it is required, the affordability it is required. Therefore, local to global India has gone through, unfortunately, last 46 conferences. Not a single conference could be held in India, international conferences, and it is our duty to see that Indian government, Indian civil society people, and people working in the field of HIV/AIDS in India make it local. So local, global to local, without making that, people will not realize. The second and most important thing, that we learn so many things from one disease to another disease. In tuberculosis, 4 medicines are combined into 1 tablet. And based on tuberculosis knowledge, we advise the local companies in India, can you combine 3 in 1? And India is made 3 in 1. So when in 1995, we were in the beggar's land, our hands were empty. Around 2000, we handed over 22 tablets for the HIV positive patient to be taken daily. And India has made 3 into 1 combination. So today 1 tablet a day. So this is a gift of India to the rest of the world. When we copy their patents, they call us copycat. But when we give something to the world, they never acknowledge. We do not want that acknowledgement. We do not want that people should thank India. But when you mention different countries and their contribution, mention one word India, that's good enough for us. Thank you. Kumaraswamy is Vice President of State Society of India, has been one of the first few voices in the country in clinical management also. So, over to Kumaraswamy.
Hi everyone. Good morning to the people who are all here in Rio in front of us, and good evening to our dearest friends who have been hearing us from India. As we heard from Dr. Gilada, that he very clearly said that how India started showing a leadership from locally to internationally in terms of getting these medications. I fully echo that. In terms of these fixed dose combination, we are talking about 3 drugs in one pill, which never happened before in the history of medicine for any other diseases. India showed the way, doing all those medications for our Indians and feeding now the rest of the world, which thereby the adherence to ARVs are being maintained. And today, those of HIV live like a normal people, which we have shown. And today, we all know that United Nations acknowledged very clearly that 92% of those, all those ARVs which are being taken over the world is from the Indian generic manufacturers. India already shown its global leadership in feeding with ARVs to the whole population of people with HIV. By the way, it's not a vaccine. Not just with that, today we have a lot of newer drugs coming up, and with the support from Medicine Patent Board, International Health Access Initiative, WHO, and UNITAID, Indian generic companies are getting technology transfers from innovators to develop them so quickly and make them to supply to other countries. I can give examples. Today, we have long acting. It's totally non-affordable from the innovators. The Indian companies have already made, should be available by this year. We'll have injectable cabotegravir should be by early next year. It's all game changers. We heard a lot in this conference, but India will make the way and get these meds to all those who need this. Not just with that, we have newer drugs like Doravirine, Latrivir. Already the tech transfer happened, then Indian companies have started doing this, and all those meds will really assist our people with HIV, live long and healthy. Not just that, and today we talk about funding shortage. There is a disruption of donor funding, and all that we have been talking about. Look at our program of NACO, National AIDS Control Organization program. We have nearly 1,000 free government ART clinics, and nearly 2 million people are receiving free antiretroviral medications. We have not heard any message when this funding disrupted globally, our program disrupted. We are getting medications. We are already showing the way how you can develop an India model for other countries who are otherwise receiving from bilateral donors, trying to invest locally by your donor. I think this is something what people can learn from the India model. Not just taking medications and giving them people. The research. Today we are talking about dual single use. This study was carried out predominantly in India, especially in 052. India's sites enrolled the largest number of study participants to show that mindfulness prevention. Today we talk about starting treatment early. A study called START. Large number of study participants have been enrolled in Indian clinical research site. They showed the way, and also studies on what to start, second-line drugs, third-line drugs, and including the studies for non-communicable diseases like retrieve, which has been enrolled a lot in the Indian sites, and thereby the data has been transferred to technical global guidelines like US guidelines, WHO guidelines, so on and so forth. India is leading the way in multi-aspect, not just on treatment, but also research now. Coming to diagnostic, this is something what we have not shown till now, but there are companies like Malbio and Chibat and others are already been setting up low-cost diagnostics and molecular assays. I think this is time that our own Indian companies set up our own diagnostic assay, thereby the diagnosis will be cheaper and generally be available to all those. We don't just do all this, but on the other hand, we also educate a large number of clinicians, both in India and in other countries, through our professional body called AIDS Society of India. So we do conferences, we do webinars, we partner with other institutions, we partner with the industry, educate clinicians, activists, and community members, and even policymakers what best. So I like to conclude stating that India has already shown the leadership what others can follow. Thank you.
Thank you very much, Dr. Kumarasamy. Now I would request our August audience who are here on site to please come up and share your thoughts on this topic. Just introduce yourself briefly, come up to the dais, and then share your thoughts. Selena, can we begin with you, please?
Before Selena speaks, come Selena. I just wanted to introduce the topic of human rights. Here we heard in the international conference how the human rights of people are violated globally. It was also violated in India. But after we fought in 1989, 1990, thereafter the human rights violations are very, very less. So there's a story of Dominic D'Souza, who was jailed because of his HIV status in Goa. He went all the way from Mumbai. See to it that he was released. The law was repealed within a couple of months' time. And thereafter, there has not been any major violation. Nobody has been jailed because of HIV positive status. We have heard a story of somebody who was jailed in Uganda and other countries. So I think that kind of movement, and Selena come from Goa, the descendants of what Dominic D'Souza started as a positive people group, and the human rights violation is stop and this is stop. Selena.
Thank you very much, Dr. Gilada and Dr. Kumarasamy. First of all, I would like to thank this advocacy efforts by Indian IAS and the network and everyone. People living with HIV now, they need treatment, but then there is access issues and stigma discrimination. But I feel that with the newer drugs which are coming, and it will still give a long life, but I think let us join together. That's what with human rights thing. What I feel is that only if we join together, I think everything can be fine. Thank you.
I think on the female front,
You, Selena. Now I invite Ashli Kohli to share her thoughts. Yeah, thank you, Dr. Gilada, Dr. Kumarasamy, and Rishi Kohli. I work with the Indian advocacy group. And I would like to know something about the talks what's happening in India for touch against 2020 and about the prevention side. When we are talking about Congress has capability and besides treatment, on the prevention side, what else is happening? And I mean, what's any against 2020 is going to happen? Because I think we need to introduce them also as part of the system. Thank you very much. I now invite Dr. Peter Borges from Human Touch. Please.
Peter is also from Goa.
So it was nice hearing from Dr. Gilada about early intervention by him in Dominic's case. I had the opportunity to lead his organization for 5 years in Goa as a secretary. And I think what concerns me now next year will be completing 10 years of HIV Enforcement Act. That's something which bothers me like across the country when we say implementation and enforcement of the HIV AIDS Act, it's not up to the expectations. Even ombudsmen, whichever are appointed, are not prepared, not trained and not even willing to take up the issues we raised up a lot of issues. The hearings by which they conduct the hearings and all it complete misery. So I think that's one area because as we talk about addressing stigma and discrimination, I think that's one area which we need to strengthen if we are going to engage by
Murugesh is from the Hamsafar Trust. Hamsafar is a trust which works for MSM, male sexual male population, for more than 3 decades. And I have known their founder, Ashok Rao Kavi, right from 4 decades. And he was a journalist, and Hamsafar Trust is a very successful intervention project in India. It has a very good impact globally.
Thank you, Dr. Gilada and Malaswamy, for the efforts. I think it's very important that we have been doing a lot of work, but I think still we need to tell back for that. Key populations need to be on the scene for driving. Because in the name of transition, everything is just being transitioned, but in the way communities are being left out, and there's not enough proper planning for transition. So I think one definitely we need to tackle that. It's not with PIs, but there are digital interventions that are going on. There's network as Coily mentioned that we need to talk about countries doing that with that, but we are still not about prep, still in the prep phase. I hope it's time to revamp our prep guidelines, bring that to the picture also, and not just about technical guidelines, but also about programmatic implementation guidelines. That's also important. I think prep is important, community intervention is important. But just not talk about nothing about us, but also to walk the talk. I know companies should be there. I think more social contracting, I think the current global for coming up. They need to see how companies take the scene, and I look really forward to Mango to see how they take along companies in the picture and just not talk about transition without involving communities. It's more of not transition to the transfer. So I think Mango will redefine transition and see how companies can be involved in doing prevention, because they're still lacking yet the first 95. So how do we take it forward? I mean, the current DG talks about mass a lot, but we need to see how our interventions, as the theme mentions, local to global. We also need to see how this thing on national level, how we strike the right balance. Thank you for this opportunity and thank you for organizing. Thank you.
Thank you very much.
Dr. Mukul from Chennai, India. She has been very active since last 3 decades, and her major intervention has been women with HIV. Also, HPV infection, which is one of the upcoming infections, and actually we have epidemic of pandemic. So, Dr. Mukul.
I just want to add one thing here. I think we need women at the forefront of this response to HIV, and we need more women leaders like you, ma'am. Take more. Thank you. I endorse completely whatever was said here, honestly. Dr. Pilada, sir said, Sumanto said, we are at the forefront of the response. We have all the tools and much and one important thing that I think, like across the world, we are seeing disproportionately women being affected by HIV in India. Not only the infection, but also the complication, social and economic and multiple other things that they face, especially even on the emergency. Violence in pregnancy and in pregnancy is very under-addressed and it's not actually being taken care of. It's very difficult for women patients combine their HIV care along with their care of other infection and other STI and their contraceptives. And as we are seeing women and the general population with HIV, I can see more women going to the menopause and needing help from medical side associated complications and such. So what we believe intervention we will see more efficacy to address women across the spectrum from younger, older folks, vaccination, care, and some simple things like PAPS care monitoring, or where should we be going towards like HPV testing, which is the gold standard for identification of early stage gold standard. Social health.
The main issue, Bobby, is there is no cable which connects the speaker to my laptop.
We have seen smaller and poorer
Yeah.
actually. We have some pregnancies
Got connected, but there the volume was low. Yeah. So it got connected. No, no, I went to the amplifier. Instantly it got connected. The amplifier made a big noise. So that's why I went there. Yeah. So that means it's connected. I have to regulate the amplifier. Here is connected.
Hello. 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 Hello.
नहीं सर अब आवाज आ रही है मेरी बड़े स्पीकर में कैन यू हियर मी ऑल राइट ओके ओके फाइन फाइन थैंक यू so hello friends thanks a lot Dr. Gilada so now we can have online speakers also over to you Dr. Gilada and Shubha ma'am please go ahead hello yes sir I can hear you clearly
आवाज आ रही है क्या अभी?
yes sir I can hear you clearly
Hear us?
yes sir I can hear you clearly hello hello madam doctor hello can you hear me am I audible hello am I audible hello can you hear me hello hello can you hear me those online those on site sorry those on site in Rio can you hear me
Hello. Hello.
hello yes ma'am we can hear you can you hear me
Yes, we have a speaker on site.
Better only go with mobile phone of Gilada, sir.
No, ma'am, if you can hear me, you need to unmute Dr. Gilada's.
Good.
So I was talking about elimination of signing off on where I live multiple times before. So I think antenatal care is much better now. The coverage is better. We have drugs, we have testing available, almost mandatory. We have issues. We should be anticipating mother to child.
Ma'am, I think you need to switch off the microphone which you are holding in your hand. Ma'am, can you hear me?
And one more thing is, the government has HPV vaccination for adolescents. I think we did a trial with the so safety and efficiency, even in women who are are at a higher risk for cancer, cervix, and other types of cancers as well. I think we should be getting more universal vaccination. And also, at the same time, we should get
We have online speakers here.
Hello? Hello, can you hear me?
Yes, we can.
Okay, fine. Okay, all right. Then you can invite Dr. Karthik Shah, please. Hello, ma'am. Can you please invite Dr. Karthik Shah from Gujarat State AIDS Control Society? He's here. Can you hear me, ma'am? Dr. Gilada, can you hear me?
Yeah, we can hear you.
All right. Okay, okay. Fine. There are online speakers also waiting to speak. So now I hope the system will work. Plan B.
Let's take online speakers now.
All right. Ma'am, please go ahead. Shobha ma'am, you need to please, can you please kindly welcome Dr. Karthik Shah?
Karthik Shah guy.
Thank you, Dr. Karthik Shah, for joining us, and we are very sorry and apologies for the technical issues which we had today.
Society and Gujarat State for Government of India's National AIDS Control Organization. Welcome, Dr. Shah. Over to you.
Thank you very much, madam. Thank you very much once again for inviting to speak for this global level conference at Brazil, Rio de Janeiro. I thank GAP Association, GAP, that is that is working under me, Gujarat AIDS Awareness and Prevention Unit, and we have worked for industrial persons in our state with the help of this GAP organization. Can you hear, sir? Gilada, sir? Can I continue?
Hello, can you hear me on the big
I can hear
speaker?
you, sir. Should we continue? Because there is too much noise over there. But I think two or three people's. Now, can I continue?
Hello, Dr. Karthik, just hold on. Dr.
Yes,
Gilada,
sir.
can you hear us clearly? Dr. Gilada? Can someone on site in Rio confirm whether Dr. Karthik Shah is audible? Can you hear my voice?
Sir, I think we can hear your voice, those who are online, but at the side there are issues, I think.
Yes, sir. Hello, sir. Just hold on. Just hold on. Dr. Gilada, can you hear my voice, please? Can some? All right. Dr. Karthik Shah, please continue, sir. Thank you.
Yeah, okay. So, yes, sir. So we have worked here in industries in Gujarat. In Gujarat, it is in an industrial area. Also, semiconductor industries are also going on here. So we have worked with the migrants. Migrants are coming from across the India, maybe MP, UP, Bihar also. And we have tried to achieve the goals which have been decided by our government. We are working for the 95, 95 and 99 goals. That is 95% of the person should know their HIV status. Till yet, we have been able to achieve up to 90.8%, and we have uh, found out about 1 lakh 9,670 people who are HIV positive, and out of them, if I tell about the second 95, that we have been able to achieve around 99.1%, and total 97,565 persons are on ART. They are taking the ART regularly from our ART centers, government as well as private. We have around 40 ART centers in government setup and 8 in private setup. Apart from that, we are also doing viral load testing, and in viral load testing, we have been able to achieve around 95.4%. Only 3,595 people are having their viral load not suppressed. Otherwise, remaining viral load samples have their viral load testing suppressed, means they have the result of target not detected, TND, like that. And same way, we have done the test for the industrial workers. We have done tests around 1 lakh 90,445 people. And we have been able to identify around 141 HIV positive people. So we are working with this GAP organization, and that is being supported by International Labour Organization. We are also trying to achieve triple elimination in our state. We have been able to identify around 645 females with pregnancy, and this year also till yet we have been able to identify around 75 pregnant mothers who are positive, and also we are tracking the babies. We are taking the babies for HIV, syphilis as well as hepatitis B. So we are continuously working to achieve the goal of the 95, 95, 99 and triple elimination. That's from my side. Thank you very much, sir.
Yeah. Thank you so much, Dr. Karthik Shah. Thank you. I hope, yeah, it was very enlightening to hear your voice. Dr. Gilada, can you hear us?
Yes, we
All
can.
right. Thank you so much, Dr. Karthik Shah. It was, we are very grateful for your leadership at the Gujarat State Chase Control Society. And I'm sure Dr. Gilada will also join me in thanking you for making such a big difference. Dr. Gilada, over to you, sir, please.
We now invite Dr. Shankar
Thank you very much, sir.
Ma'am, you need to use a big microphone. Sorry for this. No, we can't hear you. We can't hear you, ma'am. Can you please try once more?
Hello.
Yes, okay, fine. Thanks. Yes, ma'am. Please go ahead. Ma'am, please go ahead.
Yes, I invite. Please speak.
All right, okay. Anyways, sorry for this. Dr. Shankar Chaudhary is a senior person. He has really dedicated his life to this movement. Dr. Shankar Chaudhary, sir, are you there on site? Online, sorry. Dr. Shankar, are you there? I think he's not there right now. All right, I don't see him online, but Dr. Shankar Chaudhary from UNESCO has really played a key role. But anyways, we move forward. Ma'am?
Now invite Lata Mishra. Are you there, sir? My audience. Hello.
Ma'am, yes, you are audible, but there's echo. I don't know why. Yeah.
Can you please stay on your end?
Hello, there is echo, ma'am. Ma'am, there is echo. Ah.
Any other questions from anyone?
Thank you so much, ma'am. And I'm very sorry for this technical issue, as it's a very unexpected happening. Although Dr. Gilada and also many Dr. Kumarasamy is here, they are signatures for a very efficient organizing. But this is a very unpredictable situation. But anyways, we will still make it through. So anyone online, Anand Gupta, you are here. Anand Gupta, can I please ask you to unmute yourself and you are welcome to speak. Anand Gupta is a filmmaker and he has been he also founded and directs A New Dimension, and his film was screened Us and Them, which was made in 2005. After 20 years it was screened at the International AIDS Conference in Rio de Janeiro, Brazil. Over to you, Anand.
Thank you so much, sir, for this screening. This film was done in 2005, and this was basically through the understanding that, this will actually, create less, understanding towards, people who are infected. As, when I used to work with some of the, people in media monitoring, I used to read a lot of articles from NACO that, there are a lot of discrimination which is actually happening to the people who are infected, whether they are in the family or through the immediate family. So hence, this was an initiative and a thought process to, create something which has, got a life yesterday, I guess, because of you guys. Thank you so much, everyone.
Any question? Super. Any questions?
If there's nothing, we can conclude this meeting.
If there is no one else, is anyone else wanting to speak right now? Anushka, Atika, Chandrabhushan Bharati, Dr. Jogendra Tanwar. Please unmute and be welcome to speak, or we were moving towards a wrap up. Could I ask Jogendra Upadhyay to speak? Jogendra Upadhyay has spent several decades now in the response, and he leads as project director of Gujarat AIDS Awareness and Prevention Unit, ISRCDE. Over to you, Jogendra Bhai. Jogendra? Jogendra Bhai, we can't hear you.
Yes, of
Jogendra?
course, a group photo right now. Yes, of course. All of us.
I think
Grab the gun.
I think Doctor to do we will definitely do a milestone event next time. So we are very sorry for this session. Dr. Gilada sir, please can you wrap up?
Thanks all of you for offline. And it was a great meeting. We are coming from one of the to another level. All these teaching trouble, technology troubles are there. I thank you very much for bearing with us. Thank you.